All right, I'm practicing hand hygiene as I go through the room. Patient's name is Ray Williams. Hello, Mr. Williams. My name is Max. I'm going to be your nurse today. Could you please identify your name and date of birth? Patient identifies name and date of birth. And then, do you have any allergies today? Or do you have any allergies, Mr. Williams? No? Okay. All right, now I'm going to assess the ABCs, which is airway, breathing, and circulation. Airway seems good. Breathing, nothing shallow or anything like that. And circulation, skin is warm and circulation seems to be intact. No discoloration or anything like that. And I'm also checking when I do check the circulation, I'm checking his wristband as well. Okay, now I'm going to assess the level of orientation. So I would ask, could you please tell me your name, where you are, what you came in for, who's the president, questions like that. So he is 4 times oriented, by the way. And then, Mr. Williams, could you tell me if you have any pain today? And he does not. Okay. I'm going to be performing a physical assessment. I'm going to start by going by the head. So when I look at the head, I'm checking for anything on the outside that looks abnormal, but there's nothing here. I'm going to start with the eyes, and I'm checking to see if there's any lagging. All right. Mr. Williams, could you smile for me? Okay, everything looks good there. I'm going to be checking the mouth and throat, so could you please smile for me? Smile is symmetrical, nothing lagging or anything like that. All right, and then tongue seems pink and moist, nothing abnormal with the mucous membranes, everything looks good there. All right, and then I'm going to move down to the chest. So first thing I'm looking at in the chest when I pull down the shirt is going to be if there's abnormal breathing, so shallow breaths or labored breaths or anything like that. Everything seems good there. All right, and now I'm going to take the apical pulse. So I'd put on my stethoscope and mid-clavicular line, 5th intercostal space. Everything seems normal there. All right, I'm going to check for lung sounds. So I go left, right, left, right. And on the sides, everything sounds good there. Okay. Next, I'm going to move down to the abdomen. And again, when I look at the abdomen, I'm looking at the overall, so there's nothing distended, nothing perforating. It does not, no bruises or anything like that. I would ask Mr. Williams, when's the last time you've had a bowel movement, last time you urinated? He's been frequently urinating, so quite often. All right, and then I'll listen for the sounds. And checking all 4 quadrants. Okay. Again, nothing abnormal there. Then I'm going to check the extremities, and he has been frequently urinating, and he has high blood sugar as well, and he's diagnosed with diabetes. So again, I'm going to be really focusing on circulation here, and especially in the extremities. So I'm going to be doing a capillary refill as well as checking his pulses. So I'm going to be checking his fingertips for capillary refill. Again, his arms feel, his skin is intact, good coloration, dry and moist, and his capillary refill is less than 3 seconds. Again, checking his radial pulses. Nothing abnormal about that either. So I'm going to be checking his legs. And same thing, I'm looking for any discoloration, anything like edema or anything like that. And again, with diabetes, edema is something that you really have to look out for. So there's no swelling or anything like that, no discoloration, temperature's good, strength is fine, and pulses are fine. So those are good on that. All right, and then I'm going to move to the back for the lung sounds. So again, All right, checking the back. Deep breaths. All right. So the physical assessment is good there. The only thing I would like to note is that he did have a high systolic pressure. It was 140 over 82. That is a hypertensive. And the next further information I'd be giving is that the patient, again, this is his first time being diagnosed with diabetes. So this patient nursing diagnosis would be he is lacking knowledge of his diagnosis. Things to go over would be his diet, his understanding of the symptoms, and also being aware of his blood sugar level.